Hello, everyone. Thank you for joining us this evening. I'm Dr. MADELAINE FELDMAN, your host for the evening. My Tulane roots began at Newcomb College as a theater and biology major, followed by my Tulane medical degree, residency in internal medicine, and fellowship in rheumatology. I'm a native New Orleanian and a rheumatologist with the Rheumatology Group in New Orleans. I'm president of the Coalition of State Rheumatology Organizations, and when not seeing patients, I lecture nationally on the role that pharmacy benefit managers play in drug pricing and advocate for transparency in pricing contracts, both commercial and government formularies. This is one of many webinars that the School of Medicine is offering monthly. Tonight, we have some very interesting dialogue with two of our alumni, father and son, Drs. Robert and Peter Gold. I'm so pleased to be part of this evening's program. And during the webinar, if you have any questions, please put them in the chat. And if time doesn't permit for you to ask them live, we'll certainly have them answered and following the webinar and sent to you by email. Dr. Bob Gold, Robert Gold, my classmate, graduated from Tulane University in 1978 and Tulane Medical School in 1982, followed by his internship at the Ochsner Foundation Hospital and Clinic, and then ophthalmology residency at LSU. He did a pediatric ophthalmology and adult strabismus fellowship at the James Hall Eye Foundation and Scottish Rite Children's Hospital in Atlanta before moving to Orlando in 1987. He's been in private practice as the senior pediatric ophthalmologist at Eye Physicians of Central Florida in Maitland and Orlando since July 1987. Dr. Gold is on the staff of both the Arnold Palmer Children's Hospital and Florida Hospital for Children in Orlando and is an assistant professor at the University of Central Florida School of Medicine. His son, Dr. Peter Gold, is a Tulane undergraduate class of 2012 Creative Scholar recipient from the School of Liberal Arts and who followed in his father's footsteps as a Tulane Medical School graduate in 2016. At present, he is chief resident in orthopedic surgery at Long Island Jewish Medical Center in New York and will be completing a fellowship in adult knee and hip reconstruction at the Rothman Orthopaedic Institute next year. In November of 2015, as a Tulane medical student, Peter was shot and nearly killed while stopping a man from kidnapping a woman in the Lower Garden District of New Orleans. This was an impetus for change as Peter, along with his fellow Tulane classmates, founded Strong City, a 501c3 supporting organizations that ground and empower underserved youth. Wow, we got a couple of winners right here with us. So let's get right away to the questions. You know, it's kind of a cliche question, but I think it's really important to find out what, maybe what does it mean to be a doctor in general, and exactly what does it mean to you personally? This is a toss-up question for either Dr. Peter or Dr. Bob.
Oh, maybe since I'm the elder statesman, I'll start. I think that being a doctor is a privilege and honor, but it's also a responsibility. And it was great for me to be able to train both as a medical student as well as a resident at Charity Hospital. And at Charity Hospital, you learn how to be in the trenches. You learn from experts. You have emergency room training there that is just second to none. And I thought about this question saying that there are such great people that I got to learn from. But one in particular that, Madeline, you'll remember as well, is a doctor by the name of Norman McSwain. And Dr. McSwain was the head of really emergency room trauma at Charity Hospital. And it was his responsibility to train residents, to train medical students, to put you in the trenches and to learn that responsibility. And to think back of what's happened over the years, in particular, what happened with Peter, it sort of comes full circle because a person like Dr. McSwain, may he rest in peace, a phenomenal person, was instrumental in training so many people, so many residents, so many fellows. In particular, he trained a physician who's still, I believe, in New Orleans named Meg Moore, who was the trauma surgeon that actually saved Peter's life, as well as the team. So what does it mean about being a doctor? It means, to me, that responsibility to train others, to be responsible for others, and look what it's given us. So I think that's what I would start off with.
Peter, what about you?
Yeah, wow, that's a tough answer to
Tough act to
follow.
follow, huh?
When I went through Tulane Medical School, we weren't able to train at Charity Hospital, unfortunately, after Katrina. And in my short time, now my 5th year of residency, I don't know exactly what it means to be a doctor yet. But I think I have an interesting perspective in terms of being a patient. Like my dad said, I've had 2 near-death experiences where I ended up in the hospital, and I learned some really, really important things on what I want to apply as I start to figure out what it means to be a doctor. And the first was Meg Moore, my dad mentioned. After being shot in the trauma ICU at University Medical Center, it was frightening. I mean, I can't even explain how scary it was. Even my dad being a doctor and me having gone through medical school, I knew what was going on, and I had a good idea that things were going well, but it was still so scary. And so what Meg Moore did is every time she came in the room, she would give us confidence, but that confidence was based in real knowledge. So to me, it's really important as doctors that we give our patient confidence, and that's confidence that's based in what's actually going on and what the actual truth is, and really focusing on the proper expectations. So she really calmed us down every single time she was in the room, and that was so important. And then the second time, actually a complication from getting shot, I had a duodenal ulcer and a pseudoaneurysm off my gastroduodenal artery, which ended up rupturing while I was in the ICU up here in New York. And that was a little bit different of an experience. It was myself and my fiance in the hospital together, and there was a lot of fighting. It felt like we were trying to get the nurse's attention. It felt like we were trying to figure out when was the time to ring the alarm and not ring the alarm. And ultimately, what ended up progressing things in the right direction was an intern came in, and she saw that I wasn't doing too well. And I told her, hey, I don't think I'm doing well, even though my vitals were okay. I said, hey, something's wrong here. And then she told her senior, which then told her senior, which then got to the head of the ICU. And so I think what's really important to remember in those 2 things are, one, patients are so scared. Even this is so routine for us, what's going on with the patients, they're so scared. We have to be attuned to that, and we have to give them confidence. And 2 is we have to make sure we build competent teams, because if that intern didn't feel comfortable telling her senior, and that senior didn't feel comfortable bumping it up, I would have maybe stayed on the floor and wouldn't be here today and wouldn't have gotten to the ICU. So, communication and listening to every single person on the team, whether it's an intern or a nurse, and building those teams is so important.
It seems like both of you are describing something that I think we always have called the art of medicine. And it's not necessarily, how to close a wound or how to make a prescription, but it's that talking to and listening to the patient. So Peter, I'm kind of interested in what you went through. You're now an orthopedist. Was there anything that you went through in terms of these experiences that led you to orthopedics, or was it something else? What brought you to orthopedics?
So in between my first and second year of medical school, I had the opportunity to work with Dr. James Wittig, who's an orthopedic oncologist here in New York. And working with him was probably my biggest influence. A typical idea of an orthopedist is they're just a bunch of macho men jocks who don't really care about the patients, and all they want to do is take a bone saw and cut someone's femur off, or take a nail and bang it down someone's tibia, which there is some truth to that. But working with him, he really displayed some of the things you talked about. He would handwrite letters to every doctor that referred patients to him, telling them what happened with the patient. He would spend 20, 30 minutes to each patient, again, describing to them what's going on, educating them, keeping them up to par. And it was really working with him and seeing that I could use a hammer and a saw and also practice compassion. that led me to doing orthopedics, because there's really nothing better than hammering a nail down someone's femur.
Well, Bob, as a rheumatologist, I work a lot with ophthalmologists, and with the eye diseases that I treat, the inflammatory ones, we really work strongly together. And back in medical school, I remember we all took different tracks. And what led you down the eye path? I'm curious.
Well, it has to do with certain, of course, influences. And in my situation, my influence was actually my first cousin, who we were very, very close. And he was an ophthalmologist in Orlando. When I was in medical school, he was a resident up at Wills Eye Hospital in Philadelphia, actually, when I was an undergrad and then beginning of medical school. And when I was in medical school, Madeline, I really like a lot of the subspecialties. And so as I went through them, ophthalmology sort of gave you both medical and surgical, and in general is a very happy field. And so I took both of those to heart, and actually went and spent some time with my cousin when he was at Wills Eye Hospital during some of our breaks. During third and fourth year. And then, it just sort of melded. It sort of was where I liked. And, I also, as I went through my ophthalmology training, I really liked kids. I didn't want to be a general pediatrician, although I considered that during medical school. It's the only thing I really liked. And then you realize when you go through your training, and you go through the subspecialties of ophthalmology, just where your passion lies. And it was just amazing to me to see the impact that you could have on not only the lives of kids, but their parents. And you see a baby come in with their eyes crossed in the middle of their head, so to speak, and you can do a surgical procedure on them, and the parents come back and they're amazed. You can put a 2-year-old all of a sudden starts crossing their eyes and they're very farsighted, and you can put a pair of glasses on them, and the biggest smile comes over their face and their parents' faces. And so it's really an amazing type of feeling that you have to have that kind of impact. And also for me, you also is the specialty is also adults who have eye muscle problems. So you have a patient that comes in with thyroid eye disease, where one of their eyes is very proptotic or very bulging, and all of a sudden one eye is here and the other eye is down here, and they can't move this eye, and so they're seeing double. And you can go in and you can do a surgical procedure to move that muscle to straighten their eyes, and it changes their lives. Or if you have a patient that has a cranial nerve palsy where one eye is in here and they can't move it, and you can adjust their eyes, you can straighten their eyes surgically and make an impact on their lives. So they're seeing two of things, and now all of a sudden they're seeing one. So, all of those things brought me to ophthalmology, started by my cousin, who I initially joined in practice.
I heard you, when you use the phrase change their lives, I went into medical school wanting to be a plastic surgeon, and I ended up a rheumatologist. So, I mean, you sort of find your way, I think, what your river is. And when I heard you say change their lives, I think that's a quality of a successful physician. But, in talking about a successful physician, I think the general public thinks a successful physician is one that makes a lot of money, which couldn't be further from the truth. I mean, what do each of you view as a successful physician? Not the physician you look at, but you yourself. What is your definition of success?
Well, I think one thing that my dad actually just said that I never really put two and two together was we actually both like our specialties for the same reason. And I always thought it was, for me, I was like, oh, I don't want to do ophthalmology. It's too small. And that's why I want to do orthopedics. It's big, it's open. But we actually like it for the same reason that, we're both like the fact that, someone has a problem. We can both see the problem and then immediately fix the problem. And once it's fixed, both you and the patient know that it's fixed. And I think for, me doing joint replacements and him doing that, it's actually the same thing. So I never put those two and two together. So I like that. But being a successful being a successful doctor, the thing that I want to work towards, and I try to practice, every day, and will continue to, is we kind of touched on this a little bit, and it's really about communicating with the patients. I think that being successful, you're able to educate the patient and you're able to communicate with them in a way where they can fully understand the scope of their problem, fully understand what possible things we can do to either fix the problem or decrease part of the problem to make it tolerable, and then set proper expectations with them, so that we can actually care for them and meet them where they are. Even in my residency and training, I see a lot of doctors who have their spiel down, and they go in and they say the same thing every single time to the same patient. And it's really frustrating because every patient is different. Patients receive information differently, patients don't understand the same things, and it's a really hard thing to do. But in order to be successful, I think we need to try to be more attuned to each individual conversation. Is it just the patient? Is it them and their family? Like, what is the whole picture? And trying to communicate with them in a way that they need to be communicated with. And I think that'll be my challenge, to always try to be that, and always try to be successful that way.
Wow,
I look at it very similar, but I sort of try to use a few adjectives. I mean, I think being a successful doctor, you have to be engaging, you have to be empathetic, you have to be truthful, and you have to be diplomatic. And I have learned all those the hard way. Okay, it's certainly not easy. And the one thing that I try, and it as you get older, sometimes it gets a little harder, but I try to come home most days very happy, and wanting to go back the next day to work and being very, very happy to do so. For the most part, that happens. I mean, some days are obviously more frustrating than others, but I'm being happy in your profession, to me, is not necessarily financial. It is being happy to go to work every day and have a job that you really want to go back to every day.
Right. Bob, is there anything when you first went out in practice till now? I mean, the way you said it, I learned these the hard way. Any specific examples? Or, I mean, because being a rheumatologist, I've learned that, in these last 30 years, what makes me feel successful. So what were some of maybe how it has changed over the years?
Yeah, I mean, I think that there's no question that there's a lot of changes. I think that from the business, that there's a business aspects of medicine that we never learned business, Madeline, when we were in medical school. You're the boss. You and your partners in your practice, are managing your business, you're managing your staff, you're managing the HR, you're managing the finances, you're managing IT. We didn't even know what a computer was when we graduated medical school. So I think those are probably the biggest changes that I found, to sort of maybe decrease some of the happiness, okay, and some of the burden, but you have to put that in perspective, okay. Other challenges, the patients are different. I think that they are more, they're more educated. They're more, they try to be more engaging. Because you're the doctor, it's not assumed that you know everything anymore, or you're trusted anymore. So you have to earn the trust differently than I did almost 35 years ago when I started in practice. So I think those are some of the things. Obviously the public is much more educated with social media, with the internet, with knowing, they think they know a lot when they come in for their visits, and trying to educate them in different ways that get their trust in you.
Mm-hmm. It's good and bad, the social media thing. Having you and I both grown up with, the encyclopedia was where you went for information, and now everybody sort of knows everything. Peter, you've sort of grown up with this sort of digital. Everybody comes in, they've got their fingertip, they go to Dr. Google for everything. So you don't really kind of know what it was like before that, but in terms of challenges, I mean, what do you think at this point in time are some of the biggest challenges facing physicians?
Yeah, I honestly think the biggest challenge these days is physicians losing autonomy. Uh, I think, as my dad said, if you're in a private practice and you are running your own your own shop, that's a different story. But in today's world, the corporate medicine and private equity getting into medicine, a lot of these managing positions are now being managed by administrators, and there's a lot of rules being made by not physicians, with little physician input. And ultimately, that loss of autonomy, it really makes people unhappy, and it really brings down motivation. There's a book by Daniel Pink called Drive, and he talks about like three key essentials that you need to be motivated. And one's autonomy, the second is mastery, and the third is purpose. And for us, mastery and purpose we'll always have. And I think the biggest challenge is us finding new ways to gain autonomy, because the way that corporate medicine and all that is moving, I don't think that's going to change. So I think we need to be more creative and find ways to be more autonomous in our work.
You know, that leads to my next question, but sort of as a segue in that, when you talked about autonomy, that really struck a note with me as I talk about the third party people in between the patient and the physician. I go through the entire diagnosis of rheumatoid arthritis, but my first question is, what is your insurance? And I think what that does is it creates, and I've seen this other places, a sort of a moral injury, because we were trained to help people and do the best we can and do no harm. And now we have this third party coming in that sort of makes it so we can't do that, which adds stress to our lives. Stress that, you know, Bob, you and I, we never talked about those kind of things in medical school, like how do we handle stress? How do we handle self-care? But it's a huge factor now. We look at the numbers of physician suicides. So, you know, what has changed in society, and what does self-care mean to you? And Bob, when was the first time you ever even heard that phrase? And what
Probably
do you,
from Peter.
what are some tips, you know, that either of you have found, both in some, you know, surgical specialties where there's, you know, life and death there in the operating room. Let's talk about stress.
Yeah. I think there's many times I was like, Dad, you got to chill out. Have you ever heard meditation? Have you ever done yoga before? You got to relax a little bit. But no, look, I think that, you know, self-care it's really important, and I'm glad and happy that you know, the Western world is waking up to it, and me included in that, and my dad as well, and all of us in medicine. You know, I think especially within orthopedics, it really is a culture of, you know, not feeling, and the culture of you have to be perfect. This has to be right. You only get told if you're doing something wrong, and it creates a lot of walls that we put in front of ourselves. And I mean, I'll be the first person to admit this. I mean, over the last couple of years, I've worked really hard to break down a lot of these walls that I've built up in front of me, being an orthopedic surgery resident. And I just think it takes as many tools as we can use, with the goal of using self-care to help us feel our emotions, break down these walls of trying to protect ourselves from ourselves, and trying to just really feel. Because if we can feel, then we can feel for the patients, and then we can actually take better care of people. And like what I'm talking about is, like, I'm definitely not mastered it at all, far from it. And yeah, I think as many tools as we could do to try to do that for yourself, then I think we're also doing better for the patients too. So it's not only care for us, it ends up being care for the ultimate goal.
Bob?
No, you know, if somebody ever told me that I would ever use meditation as a tool, I would have probably laughed at you. And when this pandemic started, I can tell you that it was one of the things that my wife Gail and I started to do. Now, I wish I would do it more, because I probably need to do it more. but it really is a wonderful tool for people to adopt. Can take 5 minutes. It could take 30 minutes. There are so many different types and so many different people, so many different leaders. And so that's one of the things I would certainly, recommend. As well, and also in self-care, I think that you have to do other things. Exercise. I mean, behind me is my Peloton. I mean, I'm no proprietary interest in it, but after 589 rides on my Peloton, I can tell you it's one of the best things I've ever done in my life, to get on that bike, whether it's for 5 minutes, 15 minutes, 30 minutes, 40 minutes, and just really take all the stress out of my day. I do it when I come home, and it's a wonderful, wonderful thing. Okay. And so that I love to play golf. Sunday morning, 7:30 in the morning, I'm out there with our group, socially distanced, in separate carts or walking, no matter what it is, and we are playing golf. And that once a week means more to me. I wake Gail up too early, but but she gets over it. But maybe not. But it's those kind of things. You have to take care of yourself. You have to try to get enough sleep. I mean, I don't get enough sleep, but I try to do as best I possibly can. And so that's the other thing is also you have to learn how to say no. You can't say yes to everything. And I think that adds the stress. If I have 4 Zoom meetings tonight and I don't, okay, that really adds a lot of stress. I had 2, that was enough. But you have to be able to say no to things that you don't feel are in your interest and everyone else surrounding yours interest. So, Peter, you have any other?
Yeah, I 2 things. One, I think, kind of circling back to the beginning of the conversation when you're talking about charity hospital, even when I was in Tulane Medical School, everybody talks about these infamous stories about charity hospital, but honestly, a lot of the stories show a lot of the negative culture that there used to be in medicine. There was a lot of positives from charity in terms of you guys getting a lot of autonomy and really in medical school and residency being the doctor, being the one that gets the hands-on experience right away. With that is really positive. But then on the other side, there is a lot of negative culture, and again, just a lot of suppressing and a lot of top down kind of stuff. And I think you talked about a lot of stuff. I mean, for me, yoga is really important. It's moving meditation, and even something like going to therapy, whether it's one-on-one therapy or you do group therapy sessions. There's women's groups out there. There's particular rising of men's groups out there that are now virtual and online because of the pandemic. And there's a big stigma on therapy, and I really don't think there should be. I think it's super important. I know for me, it's been really valuable in the last year. And even doing something like getting a life coach or a business coach. Our parents can teach us so much, our friends and family can teach us so much, but for coaching, you look at someone like LeBron James or Michael Phelps or Tiger Woods, all these people have coaches. So how can we expect to be the best version of ourselves if we're not working with coaches? So, I mean, that's again, something I've done, and, just take the extra time to work on yourself. Don't be a zombie walking around, and I think we'll all be better off.
Yeah, I think what both of you seem to be saying are the things that I've sort of seen over the years. I mean, as allopathic physicians, we've always separated the mind and the body. This is this. And I mean, I can remember having lectures, talking about, things like mitral valve prolapse in histrionic patients, and it's all in their head. And a lot of them was so-called functional disorders. And I think over the years, we've learned how important external stresses in our mind directly, at least I know in rheumatology, directly affects the immune system. And that, I think, has brought about some just sort of biggest changes in medicine that I've seen. And, you guys being in the surgical profession, we're all, we always thought of you guys as the, just like you were saying, Peter, you go in, you cut it out, you fix it, and then there it is. But, we have to deal with not being able to fix things. And I think, Bob, over the years, I mean, what do you see as the biggest changes that, other than maybe the electronic health record, just sort of the changes in the approach to medicine? Do you see?
Yeah, let me just go back. We'll say one thing about the self-care, and then we'll go into that. I mean, I think that, you know, it's very important, not only personally, but in a family setting as well. I mean, I think that you have to set up a support system. You have to be able to communicate and listen. You have to set boundaries, okay? And what I think you also have to do is ask for help, which is what Peter had said before. If you need help, ask for it, okay? But so let's go back to, so what do I think the changes in medicine? I think maybe I'll go back, maybe the changes in the practice of medicine. I think that, you know, that I think, and maybe I'm wrong, looking at my son, I think the newer doctors are smarter. Okay, and I think they challenge us. I know that the doctors that have joined our practice, the newer, younger doctors, they're smart, and they really, and I love to listen to what they have to say, because, you know something, I'm getting old, okay? And while I know a lot, knowing from someone who is either recently trained or recently has been out in practice for several years, they have a totally different perspective, and it's phenomenal to be able to listen to that. You know, I think from ophthalmology perspective, there's tremendous technology, okay? I mean, cataract surgery, you know, was something when I was training, you know, you would take 30, 40 minutes to do 50 minutes to do a cataract operation. Now the technology is such that you can do these in 10 minutes, okay? The machinery is amazing. The microscopes are amazing. You know, you have retina doctors that are injecting medication in the eyes to stop macular degeneration. For us, pediatric wise, we have technology for vision screening. We're detecting children's vision problems so early because our pediatricians are doing that, and we have the ability to see them and to intervene early. So those are the good things of the practices. I mean, I have some bad things, but let's keep it good.
Peter, what do you think about the ability to say, I don't know? I mean, I know when I first went out in practice, that was a hard thing to say, but I find myself saying that a lot to patients now, and I think they appreciate the honesty.
Yeah. You know, I think it's something I'm thinking about a lot right now, especially as I'm finishing my last year and getting ready to go to fellowship into practice, is honesty and living the full truth for myself and to my patients. And thinking about surgery, not only saying I don't know, but saying I can't help you. You know, I'm going to go into joint reconstruction, and it's really easy to go in there and knock someone's joint off and throw another one in there. That's easy, but kind of starting to understand what you can reconstruct and what you can't reconstruct, and then saying, you know, I can't help you, or me operating on you is not going to help you. I think that's going to be really difficult, especially when you have, and you'll know this in rheumatology, a patient who is in so much pain and is in front of you, you know, on multiple medications, on opioids, and they're just begging for something to help. And I mean, that's got to be really tough. I mean, I don't, for you and your practice, I mean, you know, how do you deal with those kind of situations?
Yeah, it's tough. I think one of the things I've learned when patients come in is not like, what's hurting you today, but what are your concerns today? And sometimes it's, you know, I'm afraid my son is addicted to drugs. You know, my cousin just died from COVID. I think my husband's going to lose his job. And I think it's those kinds of things that we've learned that it's okay to talk about with patients. And it's not wasting time by figuring out what are your concerns as opposed to what's hurting you today. And I think that's one of the good changes. And if we have time at the end, Bob, I'll let you go through some of the bad changes. So yeah, we talked about self-care, and when I look at the young rheumatology fellows, one of the things they're really concerned about is sort of this life-work balance, and it goes into self-care. But if either of you can just talk a little bit about that and how important it is not to be, you know, 24/7. I mean, do you find that people go into specialties because to have a better life-work balance?
Yeah, and also just one thing to acknowledge something about your last question. I think for me personally, it is very, very hard to say I don't know. That is like something that I struggle with all the time. I want to be perfect. I want to be right. And it's really hard to say. I don't know. Honestly, it was hard. I guess it was hard for me answering that question to not say I don't know. So yeah, it's really hard. I think that's something that, you know, I'm going to really think about as much as I can now. And I encourage everyone else to as well. And I think the same thing goes towards not working too much. You know, all of us are type A perfectionists, and you know, for me personally, and you know, my parents warned me and tried to not have me do it, but you know, right when I started residency, I also, with a group of my friends from Tulane undergrad and medical school, started Strong City, which is the 501c3 that we've grown, you know, over the last 3 years.
Yeah, tell
And
us about that. How did that start? I mean, talk about it. Tell me from the beginning.
yeah, so you know, after being shot, you know, I'd woken up in the ICU, and my best friends from Tulane undergrad and medical school and my family were all there. And I kind of knew at that moment, as soon as I woke up, hey, I'm alive. I have my support system around me. I'm going to be okay. And we started to kind of investigate, you know, who was this man that shot me? And we found out that, you know, he had a mother who was on drugs, didn't have a father, and was saying a lot of things like, it's me against the world. No one gave me anything. I'm going to take what I can get. And so, you know, all of us together were kind of just talking, and, you know, we realized that if we put ourselves in someone else's shoes, it's super easy to say, oh, that guy's crazy. He's insane. That guy's a murderer. That guy's, you know, a whack job. And it's not to forgive what he did, but it's to realize that there's certain situations in people's life that make them act and do the things that they do. And when you do a wrong thing, that doesn't necessarily mean you're a wrong person. It's just the circumstances that led you to do that wrong thing that we really need to look into, and we need to work to change those circumstances. And so that's why we started Strong City, was to not reinvent the wheel, but to work with community organizations who are already on the ground and give them resources, either people's time or skills or money, in order to help them, you know, really focus on empowering underserved youth, going to the root of that problem, so that, you know, that good people don't do bad things because of bad circumstances.
It starts pretty early in life, doesn't it, Peter?
Yeah.
That's
Yeah. And, you know,
start sometimes right after you're born, and sometimes you need to get to kids really pretty early that are in, you know, sort of poor circumstances.
yeah, it's a negative cycle of poverty and violence and lack of resources and lack of, you know, education. And it's a self-fulfilling prophecy, because if those kids weren't given the resources and time and energy, then how can we expect them to do something different from their kids? And
Right.
I think a lot of us sit back and say, you know, blame it on them and it's their problem. But my dad talked about this in the beginning. As a doctor, you know, it's all about responsibility. But going back out, us as humans and us as citizens, it's about responsibility, and we need to take responsibility for our own communities that are hurting. And you know, we see it today. We see people in our communities hurting. We see people protesting because they're hurting, because they need help. And we can either blame them or yell at them or say they're the ones that are the troublemakers, or we can realize that this is our community, this is our world, and we all need to work together to take care of it. And you know, Strong City is not the answer to that. It's just one starting point. And you know, I hope if as many people want to start with us, that's what we can do right now. And I encourage people to start their own and bring their own friends and family together and make the changes, you know, that we all want to see.
Yeah, it's being involved in things, and it's difficult sometimes when you're doing training, and it's even difficult, you know, you're starting a family and then you have a busy practice. It's one thing after another to try to stay involved, but that's really important, to stay connected. You know, Bob, you have really stayed connected with our class and with Tulane medical alumni and Tulane alumni in general. You know, how important has that been for you? And, you know, what motivated you to stay so involved?
You know, Tulane has been a very important part of my life and all of our families' lives. I mean, not only was I undergrad in medical school, my wife Gail was an undergrad, my daughter Lisa was undergrad and business school, my son-in-law Jason, my brother, my sister-in-law Peter, and now and currently my nephew is getting his master's in biomedical engineering. So this school has meant the world to us, and to me, giving back after you graduate is one of the greatest gifts you can give. When our kids were undergraduates, Gail and I were involved in the Parents Council uptown. And then when later on, I was asked to be on the board of governors of the medical school, which has been a wonderful experience so far. There's another meeting of the membership committee, which I'm chair tomorrow. So that's another Zoom meeting tomorrow. But it's wonderful to be involved. You really get to the forefront. You get to see things really almost before everybody else does. You get to be in tune with the leadership. And it's so wonderful to see what our medical school is doing, currently with all the COVID crisis and with all the staff that's there. It is just incredible. And so it's been very, very important for me to stay involved, and it was an honor to be nominated for the Tulane Medical Alumni Association Distinguished Service Award, which I was supposed to get in April, I believe, and of course, obviously we didn't. But that's an honor that you just you can't imagine. I mean, it's just such an amazing
I was on
thing.
with that a few years ago, and it really is. It's so gratifying and
right.
grateful to even think that people consider you. That kind of involvement, I think, is actually also part of self-care. I mean, Peter, you're involved with with your group, and Bob, where do you think that falls in terms of what you think your accomplishments are, or how you think it maybe makes you a better doctor, being involved in something that has purpose? I guess that's the question.
Yeah,
Peter,
exactly. Yeah, I mean, and that goes back to what we talked about before with Daniel Pink's like 3 motivators, right? Autonomy, mastery, and purpose. And I think, it is something that takes up a lot of time. Every week I have to choose to, I have a Strong City marketing call, and I have a call with our director of operations, who we just hired our first hire this year. And it takes a lot of time, but it fits into purpose. And for me, Strong City, I've also learned a lot of leadership skills. I've learned a lot of the management skills. I've learned a lot about marketing, watching my friends do the marketing stuff. And I think that, like we talked before, we don't learn that stuff in medical school. And we go science classes straight into medical school, and we miss out on a lot of those soft and hard business skills. So I think not only does it give me purpose in life when I'm doing with Strong City, but I think it's also giving me skills that I take back to my residency. And now being a chief resident and running the service that I'm on, I have to manage the team and take care of the juniors and work with the nurses and the staff. So I think, a lot of the stuff that I learned working with Strong City and trial and error, I can then apply right back to medicine, which, is the ultimate purpose.
Yeah, 2 things about that. I mean, as long as now I've been in practice, you become not only involved in your medical school, you get involved with your professional organizations. I've been very fortunate to be involved in my national pediatric ophthalmology organization, the American Association of Pediatric Ophthalmology and Strabismus. And, I've been on the board for a while. I'm on the presidential track. I'll be president of the whole national organization starting in 2022. It is one of the greatest honors that I could ever have been bestowed, to be in that position in a group of, over 1,400 people that in private practice, to be able to do something like that. And the other thing in my career that has also been one of the most incredible things that has happened to me is I'm involved in an organization called OMIC, which is the Ophthalmic Mutual Insurance Corporation. It is the malpractice company that insures over close to 6,000 ophthalmologists. This has enabled me to work with some of the most unbelievable insurance minds and physician minds that I've ever been associated with. We're a family. It's incredible. And it has been, you're learning a new profession. And it has been so enriching for me to do that. And it's something those two things I'll never forget. And I continue to just harbor every single day. And one other thing I'm going to say to Peter, because his involvement with Strong City, and I can tell you that both my wife and I were shaking our heads, okay? But we have been now his cheerleaders for this. We participated in some of his activities, like exercise with certain trainers that we exercise with, and certain events that he's had. To see the project that he works with in New Orleans called the Youth Empowerment Project, to see these kids and to see the smiles on their faces and the leadership there, it's inspiring. And so through Peter and his leadership, it has inspired us to be part of his project. And that is also, again, skeptical as we were, all right, it is really amazing to see what not only my son can accomplish, but the team that he's put together and has accomplished.
So the father had to get an open mind, open up his mind a little bit to see. So you can teach an old dog new tricks.
Absolutely, and that's part.
I've been trying for 30 years.
Yeah,
So
no question. Look, yeah, listening is very important. Very important.
So Peter, when you were a child, was there anything that your father did or said that made you want to go into medicine? Was there anything that now that you're there, you go, oh my God, I never expected this? And also, what would you say when you have kids about becoming a doctor? I know that's a two-part question, but
yeah,
answer as you see fit.
I was really fortunate that, both my parents really kind of let me have the open doors to be interested in whatever I was interested in. I think my dad said it perfectly in the beginning too, that, he is really, really happy. He is fulfilled by his job. He has purpose, he has drive, and he loves what he does. And every single day he wakes up in the morning, and he goes to work and he comes home, and even if it's a rough day, he's so happy. And I got to witness that as a little kid, going with him to his office. And no one is as charismatic as my dad when he's in the office. I mean, you used to see him walk into a patient's room, he busts in the door, hey Timmy, how you doing? Good to see you, man. How are you? And the kids love him. Or some of them are probably a little scared of him, but most of them love him. And he just puts his heart and his soul into what he does. And seeing that was all I needed to see. For me, I need a saw and a hammer to have that kind of satisfaction, differently than him. But I feel the same way about what I do. And I think that's kind of what I would then hopefully pass over to my kids, is no matter what they go into, that it should be something that you commit. And commitment is one of the hardest things that we can do in life. It's really easy to say you commit to something, but actually committing to it every single day for the rest of your life is one of the hardest feats. And something that we all need to work on. And I can say that medicine for all of us, for most of us, is that, once you start that path, you're in, and you commit your life to learning, and you commit your life to whatever challenges and changes come in medicine, and you commit your life to taking care of patients. And when you can really commit to something, there's so much passion and love that can come from that. And that's something that I'm really learning every single day as I go through medicine. And that's what I learned from my dad.
So we do have a few questions. One of them from Dr. Jenny Gensler. She wants Peter to know the name of the author and the title of the book that you've been talking about. If you could repeat that again.
Oh, yeah. Daniel Pink is the author, and the book is called Drive. And I'll also plug one more book. There's a book called Into the Magic Shop by James Doty. And James Doty was actually a Tulane graduate, neurosurgeon, and he has an incredible story. And I think it's a book that every doctor should read, especially a Tulane doctor. So
I used that book during the white coat ceremony small talk I gave a few years ago. And at the same time, so Into the Magic Shop, at the same time, I told all the medical students, no matter what you're doing, every once in a while, take 9 deep breaths. And I think that's important. Steve McCollum said that we've had great topics, that burnout is real. And I completely agree. And I think talking about it is beneficial. One of the things that both of you have mentioned is therapy. And my older patients all are stigmatized and they go, I don't want to go to therapy. I don't want people to think I'm crazy. Whereas the young people go, oh yeah, thanks. I think that's a great idea. I think I need to go to therapy. So I think if that's anything, both of you have recognized that. Let's see if there are any other questions here. Just talking about how younger docs do place a high value on family and friends. I think
just you mentioned before about there is no question in my mind that if I had to do it again, I would do it again. And I also would tell Peter to do it again, to go into medicine as well. Again, I know a lot of my friends and colleagues around the country don't feel that way. I think that we have been given the greatest gift, and I think to be able to do what we do is just incredible. I mean, and it's not perfect all the time. I mean, and you go through things during your life, and when we went through with Peter's, incident, okay, it's part of life, and we're able to live a life that we chose, and that is so special and so important. And I just think so many people don't get that opportunity. And I feel grateful to be able to do it. I feel so humbled that my son is a physician and that he has, followed that medical footstep. And I think it's just incredible.
Well, and we've sort of almost glossed over Peter's experience here in New Orleans. And so a couple things I want to say. I mean, the fact that Peter went from being very safe into a situation to help someone else. I mean, I just find that unbelievable. And Bob, you and Gail must be so proud of him. I mean, it almost brings tears to my eyes to think about someone young like that going in to save someone else. And then as a parent, to have your child in the hospital. I mean, I think, kudos to the Gold family for raising Peter and then for being able to come out on the other end and Peter actually starting something that will help the person and other people who unfortunately have circumstances like him, as opposed to, being either vindictive or revengeful or bad or mad or anything. So kudos to your entire family, and you're very inspirational. I can't say enough about that. We're down to the last few minutes. Somebody did want to ask about telehealth and how you view telehealth. And Bob, I don't know how much telehealth you can do with eyes. I do a lot, and I think I'm going to use it after COVID goes away because it's very helpful for some patients who aren't having something specifically wrong. Bob, what do you have to say about telehealth?
So in ophthalmology, there are not a lot of things that you can do, but during especially the first few months of COVID time, we were using it quite a bit. Okay, if a patient has a red eye, if the patient has a stye or a chalazion, if it was a baby with a tear duct blockage, someone who had an acute crossing of the eyes, that we could look at to see the urgency of the situation. Obviously, you can't do a complete dilated eye exam. So we were able to do some triage with it. Now, for example, sometimes I'm doing my pre-operative consultations for patients I used to bring into the office, for whether it be an eyelid procedure or a tear duct procedure, in order for them not to have to come into the office. We do all the consent forms online. We do all the discussions via FaceTime or Doxy or Zoom or whatever. So I do think it has a place. I think it's a little bit limited in ophthalmology, but I do think it has a place, and I think it will be around. And so we did use it. We were probably doing 6 to 10 a day at the heyday. Okay, now maybe only a few a week, if that, but it can be beneficial in certain
Yeah.
situations. Some people don't want to come to the office still. I mean, so you
No,
just, have that conversation on the phone and you do the best you possibly can. I've done it with ortho, Peter. I don't know
I
how
don't,
much.
yeah.
Yeah. So I mean, it's really for, for patient convenience. They have been doing it for the first post-op visit. You can have them show your screen, do a quick wound check, make sure there's nothing that like is egregious and needs to happen. There's also a lot of interesting stuff with physical therapy. So doing virtual physical therapy with patients. There's even some like AI robotic kind of virtual physical therapy that's going on as well. And kind of all under the guise, especially within total joint replacements, in bundled care and trying to limit the cost. Patients going to a rehab facility or subacute rehab after, that's pretty much all gone away. Most patients are going home, and then trying to get patients to not do physical therapy is another way to bring costs down. So I think the virtual physical therapy has also been increasing, especially with COVID.
Yeah, I mean, I've found a lot of patients do like it from home, but I will tell you, and we talked about it in the beginning with the art of medicine, actually touching a patient makes a huge difference. The same way they talk about holding newborns, if I touch a patient, someone will say, well, gosh, nobody has ever felt my joints. No one's ever touched me. So I think that is something that's important that we're missing. And yet, like you said, out of convenience and certainly during COVID, it makes a big difference.
We all have to get close. We all have to get close to our patients. That's part of the danger now.
Yes.
In COVID times. I mean,
Yes.
our office has changed. We have barriers in the slit lamps. We have barriers on our indirect ophthalmoscopes. We try to not have these kids scream in our faces. But something, it's part of what we do. It's part of the risks that we take.
We've got like 2 minutes. Can either of y'all kind of sum up your entire life thus far in 30 seconds or so each?
Go ahead, Peter.
No, you can go first.
I appreciate being able to be here, Madeline, with you, my classmate, and of course with my son. It's very special that he also followed in the Tulane footsteps. And it's wonderful to be able to be practicing medicine, even especially at this period of time, to help people and to continue to do so. And it's a privilege, and that's really how I feel about it.
Peter?
Yeah, for me, I guess two things I wanted to share. One, I talked about that James Doty into the Magic Shop, and he has a quote that I love, and I have on my phone, and I actually read it from time to time to kind of just remind myself. So the quote that I wanted to share, it's be a doctor with your heart, listen to the patient's story, acknowledging their struggles and their success, discuss it with them, and realize that the people that you take care of, everyone around you, all walks of life, were also similar. And I really love that. It really, centers me and reminds me that in the fast day to day and operate, that, these are people, these are families, and to always remember that. And I'm grateful to have my dad and my family always be there and always supporting me through all the challenging times of my life. And they have always been there, and I know they always will. And I think that's it's probably the greatest gift a son can have. And as doctors, that's a gift that we have the responsibility to give to our patients.
Wow. Well, I can tell you it's been an honor and privilege to be here with both of you tonight. And thank you to the entire audience for joining us this evening. If you had a question that was put in the chat, or you have a question now that hasn't been answered, please send it on in, and we'll make sure that the doctor's gold will get an answer back to you through email. So please continue to watch for the School of Medicine monthly email invitations for the webinars. And once again, thank you to the Dr. Goals, and thank you to everyone. It's been a wonderful evening.
Thank you.
Thank you so
Thanks,
much.
Madeline.
Thanks. Good night, all.
Good night.